In this third screencast, we'll consider the impact of hospitalization and treatments on appetite and food choice in an acute care setting. Keep in mind, there are similar but uniquely different considerations for patients in transitional care, long-term care, medical or psychiatric rehab, and other healthcare-focused operations other than the small community hospitals that might be similar to those in San Luis Obispo and in small towns around the U.S., as well as large tertiary medical centers usually located with universities in urban or metropolitan areas. Patients admitted to acute care hospitals are mostly older than 65 years of age, yet if the hospital has an obstetric unit, there will always be women of childbearing age and other younger adults and children admitted for surgeries or traumatic injuries or other diagnoses. So there will always be a need to construct a menu with food choices that appeals to both older and younger adults. If the hospital has a pediatric unit, they will usually have a separate pediatric-focused restaurant-style menu that includes things like hamburgers, hot dogs, spaghetti, grilled cheese sandwiches, and chicken nuggets. Pediatric or children's hospitals serve infants, children, and teens exclusively and will have appropriately unique cycle or restaurant-style menus. We won't focus on pediatric menus in the class, but many of the same principles apply. This slide shows some of the common diagnoses that result in hospital admissions. The image is of a man with COPD, chronic obstructive pulmonary disease, one of the conditions that most dramatically diminishes appetite and contributes to malnutrition because the patient is often unable to eat and breathe at the same time. When it's a choice between eating and breathing, nutritional intake suffers, complicated by the increased energy demands of labored breathing. So you can see that engineering a menu that suits the needs of most hospitalized patients requires a careful balance of foods that meet cultural and nutritional needs of patients in all stages of life, with a cost-effective variety of comfort foods and popular alternatives that offer nutrient-dense and appetizing choices that help prevent or reverse malnutrition. Every patient admitted is potentially at risk for malnutrition, and the agency that accredits hospitals requires nutrition screening within 48 hours of admission. For many patients, this leads to additional nutrition interventions, a topic for another class. The sedentary activity level of most hospitalized patients, along with some or all of the other factors on this slide, can all have a negative impact on appetite and the intake of a diet with adequate calories, protein, and other nutrients. Of course, parenteral nutrition is an option in some cases, but the general philosophy in healthcare is, if the gut works, use it. Medications are an important part of every nutrition screening and assessment because of significant changes that impact patients. Important for everyone, but magnified for patients in acute care because of the acute nature of their treatment. And while MDs, RNs, and pharmacists are all trained in what we call drug-food or drug-nutrient interactions, the RD is often the advocate and educator for the patient because of the focus on nutrition status. So considering that many patients might be experiencing changes from their norm in some or all of the physical responses to treatment, it's recommended that every meal include at least one moist, juicy comfort food that might be appealing in spite of changes in physical condition. We can't consider healthcare food without talking about constipation and gas. Again, it's a balancing act considering the needs and tolerance of individual patients. Because of the inactivity of hospitalized patients, foods pictured on this slide, though nutrient-dense and well accepted by many seniors, are not recommended for service to patients unless the patient actually chooses the item from a menu. So an alternative that is less gassy should always be included on the menu when one of the choices is beans or cruciferous vegetables. Gas or flatus is normal, and in fact physicians and nurses routinely ask patients if they've passed gas, and usually the nurse wants to see bowel movements before flushing. Both are important indicators of gut function, but gas that's painful sometimes feels like a heart attack, and sometimes stool softeners must be prescribed. Our goal is to provide adequate fluids and the right balance of foods so that medications and discomfort can be minimized or avoided completely. One last food to omit from menus in healthcare is grapefruit and grapefruit juice. Furanocoumarins are phytochemicals found in some fruits and vegetables, but are found in clinically significant amounts in grapefruit, and the consumption blocks or disrupts intestinal enzymes that impact the function of a variety of widely used medications that are listed here. So as to avoid accidental ingestion, many hospitals have no grapefruit on their menu at all. That overview concludes this screencast. We'll continue with more specifics about constructing the menu in the next session. Thanks.